Just listen.
You can't heal something you're not aware of. And what happens when you go through pain, you go through dissociation. So you dissociate from that point, that painful point. And the breath work helps me connect back there. So I use breath work to connect to the pelvic floor.
Claudia de Santos, biokineticist at Synergy Holistix. Thank you so much for giving the time out of your day to do this and for sharing your knowledge. You have a very cool setup here. I really enjoy it. Do you want to start off by just telling us a little bit about yourself and how you got into biokineticist?
Sure, that's quite a story. I don't know how much to tell of it, but I'll go for it. Thank you for having me and interviewing me. It's quite a pleasure. So I've always been involved in sports my whole life. Started gymnastics when I was really young, and if I wasn't taking warm-ups or helping youngsters who've fallen and hurt themselves rushing for ice, that's been the role since I was little.
Okay.
And I remember wanting to become a physiotherapist because at the time that's all we really knew about. And as the years went past, I was pushed more into like the business side of things, which I'm useless at, remembering random facts, and so on. Just wasn't my thing, and I had to take 2 gap years after high school, and I just decided to go and follow the healing world, and I'm so grateful that I did. So landed up here, and I think it's part of my destiny or fate, however you see it. I love what I do, so I'm very grateful. Yeah.
So it's your calling, what you're doing right now.
Definitely, because for me, I mean, I don't know how much I'm going to share, but I was actually caught cheating in my matric final exams.
Wow, okay.
Not a lot of people know, but a lot of my patients know because I share. I'm very vulnerable in my sessions, and that had to happen because I had almost literally stopped all ideas about going into this industry and follow business economics, and I was actually caught cheating in business economics.
Okay.
And it's changed my whole path, and at the time I thought that doors were just closing, and it was just actually opening other doors as an avenue for me to follow this journey. And if it hadn't happened that way, I wouldn't have met the cricketers where I worked with the Lions team, which I further went on to work with the Proteas, and then I met Wayne. So if it didn't unfold in that way exactly to the T, where would I be now? Probably still studying business economics, 3rd year at varsity somewhere.
Wow, 3rd year for a long time then. Eh?
Yeah, so that's my story.
Yeah, well, the reason I wanted to get you on is because being a cricketer myself, I had a shoulder injury, struggled for long finding someone. I was in Bloem, so it was limited. And then came to see Wayne one holiday, and he managed to help me within 2 weeks, and then send me to you for also about a week, and we did 3 quick sessions in a week. But in those 3 sessions, you together with Wayne got more progress out of my shoulder than any other biokineticist or physio or whatever I went to in a span of 2-3 years. So there must be something unique to you, and the fact that someone like Wayne has trusted you for all these years, because that was a long time ago, shows that there's obviously something special in what you do. So that's what I'm trying to get into today. I'm trying to dig into what do you do differently, and no disrespect to other biokineticists. I have a lot of good mates that are bios, but there is something special about you and what you do. So let's try and get into that.
Oh, put down my walls, yeah. Thank you. Thank you. So I think every practitioner has a different role to play. There are a lot of people who need to go to a bio and it purely be within these boundaries, and that's what they feel comfortable with, and that's where they're willing to work. For whatever reason, I pushed the boundaries a little bit further and delved a little bit deeper. And I think it does come down to not a learning disability, but there's definitely a portion of my brain that works not off textbooks or texts. It works off visually. I can't have a conversation without pictures. Whenever we're doing a business meeting, I'm like, show me the pictures. And when a human comes to me and a person comes to me, I see the full picture. I'm really observant and understanding. And observant means not just in the physical body. I don't just see your shoulder. I listen to your words. I watch how you come in. And that tells me so much about a human that I can actually work with. So yeah, pushing and opening up the boundaries and not working within a box that we were taught at varsity. Coming back to the learning is, often I would see someone and I would struggle to remember, and this was in my early years, I would struggle to remember the science behind it. This is what you do and you stick to it. And I had to literally just put that away and really learn in a different way compared to what I was taught. So I think learning that way has really just opened up my ability to see a person and treat them in a holistic way that I'm so grateful for.
Yeah, that's cool. One of the questions I wanted to ask you is, in a field like biokinetics, if I get that word wrong throughout, I always say it wrong.
Too.
So, but one of the things in a field like that, or physiotherapy, is there's obviously a scope of practice,
Yes.
The HPCSA, and then universities train you in a way that the lecturers have done some research and they want you to learn what they've done. Do you feel that kind of limits what you're allowed to do compared to what you actually want to do and feel you need to do with patients?
You know, with any kind of work that people do, there's always learning. You'll never stop learning. There's so many times where I'm like, shucks, I don't know enough. I've got to keep backing myself and saying that I know a lot and I can help a lot, but there's still such a big part that I don't know. I do respect what I learned at varsity, and I'm very grateful for what I'd learned at varsity, because that's your foundation. And we all need that good foundation. I do think sometimes we do get boxed in as a biokinetics profession. But again, you've got to respect that and work with what you've got. How do I do this without implicating myself?
Yeah, sorry, I don't want to put you in a bad position.
No, not a bad position. There's obviously red tape, and you've got to work with that red tape. So we are not allowed to do like manual therapies, we're not allowed to do fascial work, and we're not allowed to do massage work. But what we are allowed to do is you can't stop yourself from learning. What we can do is we can get that, we just can't put it through medical aid. So
Yes.
there's rules treating that in a different room. So we've got a few different rooms in the center here. We've got a pool for aquatherapy, which is one scope. We've got this room where it's very much exercise-based, which is the biokinetic scope. And then for some patients who do trust me, and they're no longer my patients, I do fascial work, linotherapy, but that's outside of the biokinetics. I don't advertise that on any platform of biokinetics.
Yes.
And it doesn't go through medical aid. That they pay separately as a different kind of therapy.
Yeah.
So for me, I love working with my hands. I've always felt like a lot of my intuition and a lot of listening to the body comes through my hands, and I have to touch, I have to be hands-on, and that's when I'll move that practice out of the biokinetics, out of the exercise, and into the different field. I mean, we have to fill our whole box with as much as we can and work with what we have, because at the end of the day, it's not about me, it's about the person I'm treating, and I owe it to them to have as much knowledge in different fields that can help them and integrate it together.
Yeah.
So yeah, that's basically what we're dealing with when we're dealing with scope. It's medical aid, but if you learn what you learn, you can do it outside of medical aid.
Yeah. And there's got to be the trust between the patient and yourself. You can't go willy-nilly about it and treat any patient with fascial release when it's not your scope of practice.
Yeah. So again, it's not really about scope of practice. It's about, so I am a medical professional. I did a BSc, 4 years BSc, and I've got that biokinetics knowledge. Nothing stopping me from going and learning linotherapy, when other therapists, such as personal trainers and Pilates instructors and massage therapists, can go and sell themselves as liner therapists. So we're just, again, boxed in a little bit by the laws of medical aid and health professionals council, because we're held more responsible.
Yes.
So we've got the knowledge. It's just about putting it in different sections and different rooms and different boxes.
Yeah.
So yeah, it's not willy-nilly. I think we've got enough knowledge as biokineticists to delve into those side of things.
Yeah, for sure. Yeah. I mean, there's obviously an interest in the body and in the way the body moves. So if a person does have a bit of vascular release that they need to go through and you're busy treating them, I don't see why that's a problem. But I have heard of a case where one of my close mates that's a bio actually moaned about another bio in Cape Town, because this other bio was actually trained overseas as a physical therapist. But coming here, he was registered as a biokineticist, but he was still doing work that a physical therapist does.
Yeah.
And there was an ethical issue that they had with him. A great healer, a friend of Wayne's, he's actually treated me as well before for my back, and he's amazing at what he does, but they had a problem with that. So
Did your friend ask you if you got better?
No, not at all.
So you've got to understand where that conversation comes from.
Yeah.
He's obviously feeling restricted in what he believes he can offer. And instead of looking inwards and dealing with that, he's projecting it outwards to the therapists who are helping.
Yeah.
For me, if someone says, someone did this to me, and I said, well, how did you feel afterwards? And if they say, I felt amazing, then I'm like, okay, that's great work. Continue with that.
Yeah.
If they say, I was really hurt by it, I would take a step back and observe, okay, well, was it something that happened once in 1,000, or is this a continuous state of injury that's happening because the therapist isn't knowledgeable enough? But fascial work, loads of people do fascial work. I mean, you can do a fascial stretch where, I mean, we do that often. There's fascial stretching that can happen that we can facilitate that. But I think it comes down to your friend didn't ask you if you felt better.
Yeah.
And had he asked you that, maybe the conversation would be different.
Maybe, yeah. Well, that's the purpose of going to a therapist, isn't it? Just to get healed. And maybe overseas a little bit more, or maybe I'm wrong in this, but I feel there's so many more people overseas that can practice as a healer without having a registration with the health body. Some of the guys I follow are fitness trainers, but they're doing, mindfulness training, they're doing yoga training, they're doing all these type of things, but they don't fall part of a recognized body. They just kind of self-studied and became smart at what they're doing. But they accept it and they're quite famous in what they're doing. Compared to here, you're very much only a healer if you've actually been registered and can be claimed from medical aid and those things.
Yeah, I think I actually think it's the opposite. Yeah, I feel like as medical practitioners, we box ourselves and we rely so much on our medical background and our studies that we scared to venture out into the healer portion. Firstly, because healing in South Africa is only taking off now, and to be a healer means so much more. But I do feel like if you don't have a degree and you don't have that constraint of a medical oath, you're allowed to play in the deep end of what it means to be a healer. So that's why you'll find medical doctors who don't do mindfulness, who don't do meditation, who don't do breath work, because they rely so much on the science that they've been boxed into. But that's changing now, and it's quite exciting where we're going with healing in South Africa.
One of the purposes of doing this podcast was to reach out to people like that and try and show South Africans that there are people out there. So this center, everyone in the center working together, which we'll touch on now. And then there's been Dr. Riaz Mutara, Dr. Ilamanga I'm seeing on Wednesday.
Oh, that's going to be exciting.
Yeah, so they're all very, very, very clued up in both the traditional Eastern ways with the mindfulness stuff and then the Western, medicine ways. So I'm excited about those type of conversations. I want to ask you about the center. So being part of a team like this, it's called Synergy Holistix. So obviously there's a focus on synergy and a focus on holistic healing. What does it mean to you, and how has it helped your career being part of such a team?
So, I mean, I started my practice a year after doing my internship. I literally met up with Wayne through a cricketer that I was treating, and I only know this. This is all I know. So I don't know what it feels like to work outside of a practice that isn't holistic. We hold each other. So in the sense of holding each other means if we are held, we can hold the patient a lot better. For instance, often I have a patient who books directly with me before seeing anyone else, either through word of mouth or whatever the case is, and they come into me, and it's something that I know my skill set isn't going to help them as quickly as another practitioner. And it's a 5-minute conversation and say, wait here, let me go see if there's space with Marco or Wayne. And that way their time isn't wasted, their money isn't wasted, and you form a good relationship with that patient because you're putting their needs first.
Yeah.
Working with such an incredible team expands our knowledge. I don't know if you believe that consciousness knowledge moves without a conversation.
Yes.
And just by being in a space where minds are open to new things, we almost seep in that. So I'm very grateful to work with the people I work with. The psychologist, the craniosacral therapist, they all have their own knowledge and their own understanding of how they work. And I get maybe 10% extra from just working with them, and it's such a blessing. But mostly for the patients who come in here, that you don't always know as a patient who to go to first. And sometimes you jump around from one to the next. There isn't a conversation being had between doctors and therapists because they're not working together. Wayne will pop in often, talk about a patient to me, and leave, and that happens in split seconds. So yeah, it's great.
Yeah. There's something else with this center that I found, though, the welcoming and warmth when you walk into the doors. Something makes me want to be here more, if you know what I mean. And you obviously only come here if something's wrong with you, but I feel like I'd like to come here even when when things are going well. I want to come and just share and stuff with people like Wayne. What would you put that down to, that energy and warmth?
So it's funny that you say that, because often I see people hang around here and I'm like, oh, you back here for more treatment? Like, are you, They're like, no, I'm just here for coffee and hanging out. So I'm like, cool. We all love what we do. And the fact that we love what we do and we love people, everyone here is very social, and you become friends with everyone, and it's great. It is like a little community that we have, but we care about people, and people feel cared for here, I hope, for majority of the time. I also think we're all pretty vibrant, and we're all pretty, not that but we're all pretty young. And we have fun at work. We're teasing each other, we're playing pranks, and we enjoy our work. I think that's what it is.
Yeah, that's very cool.
Yeah.
I want to shift gears a little bit and get into the practical side of things.
Yes.
What would you say is your favorite thing to work with, or what is your specialty that you like to work with most?
So I definitely love mechanics. The why. It's easy to kind of treat a ligament injury or a muscle tear, that hamstring's torn. You go and you fix the hamstring. For me, I like the why, and I love the picture. So when I look at a human body and I see the twists and the lifts and the turns, I love to unpack that. And unpacking it means aligning the body and the joints through specific movements, and that's what I love.
Yeah.
So mechanic correction that leads into injury prevention and also helping treat that injury.
What is like the way to go about things? Because we see a lot of injuries, specifically in sport, obviously, and recurring injuries. Guys that tear ligaments in their knees will often do it again 2 years ago, or maybe do the other knee. How do we prevent that?
That's, again, mechanics. You experience a knee ligament tear whether you do an operation or not, whichever one you decide, but the integrity of that ligament has now been damaged. The chances of that ligament coming back to its full potential because of the collagen damage in there it almost like tightens up even more, so it can't take tensive loads. So the body and the brain understands that. There's a conversation happening in our bodies that we don't even know. And it's 24/7. The brain is speaking to the body 24/7. And what the brain is picking up is saying, there is an injury to my knee. It is not stable. It is not protected. Find another source of stability. And that's, in a short-term acute state, is really beneficial to further damage. And that's why you'll find limping and you'll find all of those kind of changes that we do in our body to protect ourselves. However, that acute state then leads into a chronic state of mechanical changing, and the brain will continue to say, weight load on the other leg, and that's when we get biomechanics change. So that's what I love to do, is I love to see a human body, see where they're disconnected from, and start to change that.
Yeah. So, I mean, does that come down to... so the guy injures the one knee, then he injures the other knee. I don't know how often this happens, but I've seen it in rugby quite a lot. Does that come down to the other leg, or maybe through the back or wherever, the hips, there's been... What is the word?
Compensation.
Like compensation.
Yeah, so the brain picks up that it's got an injury on the one side. It has to take load off of that injury. Load can't just disappear. It's got to be transferred. And that's when we transfer either to the opposite knee, the opposite lower back, or the ankle. Whichever the joint is that takes on that excessive load, that muscle then becomes overworked, and we get an overwork injury.
Yes.
So, that's like our common injuries. And that's if you don't correct that state from an acute mechanical change, and it becomes a chronic mechanical change. That's what rehab is. It's not just about that knee that you've injured, but it's making sure that the brain understands that that is safe, that is strong, and that you can use that part of your body again. Or else the brain will continually transferring weight and load onto another portion of the body.
And that's an unconscious thing. You're not doing that purposefully.
Exactly. That's a conversation that the brain's having with the body 24/7, saying, I don't feel strong here, transfer load.
Yeah. How often do you see patients that don't complete their rehab?
Often. And it's sad for me because for whatever reasons, either financially, they don't continue with the treatment. They don't see the results they want in the first few weeks. There's so many reasons why people don't finish rehab. Often they do come back like a few months later, and it's almost like a mental shift has happened.
Yes.
It's almost like some people are willing to fix and help before they hit rock bottom, and other people literally need to hit rock bottom where it's so bad that it's become, it's affected their way of life, that they now put everything aside and say, okay, this is important, I have to do the work now. So there's many reasons that people don't finish rehab, but it does happen, yeah.
And would you say a lot of that is mental? It's the motivation behind it, and not seeing the changes, and being, just upset about your injury that you're kind of giving up and things?
Definitely a part. I also think a relationship with the person that's treating you. Not everyone that comes to me is going to like the way I work. I could trigger some things in them that they don't like or they find offensive, and which has happened before.
Yes.
So they choose to go somewhere else. We try our best, but we're not always going to hit 100% of the mark.
Yeah.
But taking responsibility for your own rehab and your own treatment is a big portion to getting better. We can't do all the work.
Yeah.
And part of biokinetics, and why I love it so much, is we make you responsible for your work. You're not always going to come in and be treated on and then leave. You have homework to do. You have, there's so much depth to rehabilitation. So, yeah.
Yeah. On another mental note with sports injuries, how often do you see that the injury you're treating is both the physical trauma, but there's also an emotional trauma attached to that?
So often, and that's part of where my healing comes into, is that I do tap into that. If I'm holding on to a part of the body that's been injured, there's almost like a cellular communication that I feel. I often feel either sad or I feel very angry when I do treat people, and in the beginning, when I was much younger, I didn't actually know what it was. And as I got older, I started to understand that it's not me that's feeling the stuff, it's the communication through the cells that I'm feeling. With that comes a whole different aspect of biokinetics that we can definitely tap into, and I think more people are doing that. Oh, sure. It's so broad that I don't even know where to start, but it's like the chicken or the egg kind of situation. Did the injury develop before the emotion? I kind of think that the emotion was there, and we never listen to our emotions. We never listen to our mental state. We never listen to the conversations we're having in our head. And when the soul or the body gets tired of trying to communicate that with you, it turns it into a physical thing that you hear. You know, I hear a shoulder injury. I feel it. I know it's there. I must seek treatment. It's almost the body's way of telling you there's something going on, something deeper. So in my sessions, if the person comes and they're ready for that, I've had a lot of people who say they don't know how they got here, or they find me on the internet and the words I speak on my website rings true to them. That's when I know that they're here to do some deep work. And that's when I tap into Kim and I use Peter, where we can uncover what is the belief system around the injury. I remember treating this guy for a shoulder injury long time ago. He was a big guy, broad guy, and when he was young, he had anger issues. And he literally ripped the door off the hinge, and his dad shouted at him and said, "If you ever show anger in this house again, I'm kicking you out." And he had suppressed so much of that anger within himself through his younger adult years, that he came to me for shoulder injury. And I was treating him, and I started to get super angry, but he hadn't told me this yet, and my face started to change, and I was like, sure, I need to tap into more. And I said, why are you harming yourself when you play squash? And he said to me, when I get really angry, I go and I play squash. And that word angry just triggered, and I was like, I need to ask more questions. And I said, why do you need to use squash to be angry? Can't you just be angry? And he told me the whole story about his father and everything. And I realized that the anger that he was carrying in his shoulders is unexpressed anger.
Yeah.
Often we use exercise and we use sports, and it's so sad because exercise and sports should be glorious and fun and joyful, but we use it to run away from ourselves. We use it to get in a different mind space. We use it to get angry, hit a bag when you're boxing.
Yeah.
Instead of just going for the pure physical endorphin rush of it.
Yes.
So yeah, I've had a lot of experiences with people who carry emotions in their physical body, and it's interesting to uncover.
Yeah. So if I can get personal quickly, the one thing that I dealt with my shoulder was it became part of me. It was so long. I think I was 17 and only fixed it at 20. So for those 3 years, it sat with me, and it was the reason I never played as many cricket games as I wanted to, or played at the level I wanted to. And even then, when I came to see you guys and it got fixed, and I went back to Cape Town with rehab, and I could bowl as well as I was bowling, but I was always feeling like I'm 3 years behind, and I always blamed the shoulder. And it became such a part of me that even 3 years after that, I was still saying, my shoulder is injured, I can't play cricket and whatever. But it wasn't. When I was bowling, or when I play indoor cricket now, I can bowl as fast as I want with no pain, no issues, but there's still this mental thing that it's there. And, thinking back now, I actually spoke to Kim about this for a long time, and we were working our way back, and it became such an emotional discussion based on a physical injury. And that's also why I wanted to chat to you, is to see how would people deal with that? How should they go about dealing with something like that?
Yeah, that's a difficult one, because when someone's experiencing pain, you don't want to be dismissive about it. You don't want to tell them that, okay, stop thinking about the pain. You've got to respect the pain. It's trying to tell you something, but you also can't give it power. So what I've learned with psychology and working with Peter, which is which is incredible, is that we only have to be observant of it. We don't, if we don't give it power, then it is just something we have to observe, and we don't delve into it. It's the conversation you had in your head from when you were young. I can't. When I'm treating someone now, and this is what you learn as you go in through some years of treatments, is that instead of saying I can't, say not yet.
Okay.
So the shoulder is strong, but not yet.
Yeah.
Or as we start to get better, the shoulder is strong, we can. I suppose that's when sports psychologists come into it, and that's
sure.
when we've got to refer on, because we can't always go into that scope, though we can bring that into our sessions. It's like I will never say, oh, which is the injured side? I'll say, what are you here for? Or how is the bad leg doing? Everyone like refers it to the bad leg or the bad shoulder. Like that cell is listening to every word you are speaking, the cells around that injury. You've seen that research where people talk or they play music to water and the cells change. Even when I'm treating, I'm saying it in my head because I know I don't want to sound cuckoo, but when I'm treating someone, I'm speaking to the cells of the muscles and the cells of the ligaments, and I'm saying, you are strong, you can do this. And teaching that person to have that same conversation with themselves, I think takes a long way.
Yeah.
Yeah.
Do you think they should add a psychological part to the biokineticist and the physiotherapist, university course? Should they add more? I know there's like a course in sports psychology a semester, but it really doesn't touch on anything like that.
Yeah.
Do you think they should add something like that to it?
I mean, I definitely think it would go a long way. How much can you tap into, though? Because you've studied psychology for so long, it's like a full degree on its own. How much would half a semester or a semester teach?
It wouldn't really at all, no.
Yeah, and we get into such a habit of having to go from ground roots up. Sometimes maybe if we do just slot in, this is the conversation we need to have with people. So instead of having like a psychology, maybe have like an NLP kind of program where you can learn NLP within like 6 months.
Yeah, with trauma release or something like that.
Exactly. So instead of learning the whole psychology behind it, just know that words have power. Yeah. And that's what we would generally use here, so it might work elsewhere.
It comes down to intuition though, doesn't it? You seem to be very intuitive in the way you watch people when they walk into the doors and things, and listening for messages that are latent, that aren't being spoken. I can see you watching me when I'm standing around. I know I have bad posture.
Did you notice that? I was like, stop judging.
I think I noticed because I expected it. I think if I wasn't thinking about it, I would have not noticed. But do you agree with that? Does it come down to intuition?
Yeah, and that's a difficult thing because I have gotten it wrong. Some people want to just come here and me work in a small box. They want to just come here and exercise. And I have lost patience and the opportunity to help someone because I did work bigger than what they were here for. So observing someone is one thing, and then understanding what they are ready for is another thing. Yeah. We can sometimes scare people away just by overdoing it and giving too much information. And sometimes people don't want to do the other work and they're just here to exercise. So I will do the background stuff, not the energy work and stuff like that, again, scope of practice. But so Flip, what was it again? What was that again? Like just about...
Or intuition, and you said you get it wrong sometimes because people just want to come here and exercise. They don't want you to talk about what they're feeling and things like that. Yeah.
I mean, like I said, I've gotten that wrong sometimes. And I have given people information about what they're dealing with because of intuition, and they're not ready to go there. Yeah. But now I'm getting so much better at it because I can see when people want more information, and that's really cool.
Yeah, and obviously with the experience, you learn how to build relationships with different personalities as well. So
definitely. Just observing someone and knowing how they are, what they want, and managing that. A lot of people do come for more, and I'm happy to add that value to it. Other people don't want to know about it, they just want to get strong.
Yeah. Can you chat about prehab a little bit? I've heard this term fairly recently. I think it might be new in the science or just been given a term, but what is prehab and what would people use it for?
So we've got two different sides of prehab. Prehab for pre-operation or going in for a surgery. So we would make sure that someone is their strongest, their most mobile to undergo surgery, and that means that their post-hab is more effective. The muscular system and the joint system are obviously damaged pre-operation, and going into an operation without having done some form of physical or strength work kind of leaves you still in a bad state, but now being surgically operated on.
Yeah.
So what we've been finding is doing a few weeks worth of exercise and mobility has put their body into a better position to respond and to strengthen post-surgery. And we see the differences quite drastically. Someone who I've just now recently treated with a double knee replacement is really struggling because he was so stiff and so tight and so sore before op.
Yeah.
Now he's sitting with surgically operated knees and bruised from groin to ankle. If he had done some form of mobility work and stretching and strengthening, I think his muscles would have been in a better state and not so stiff post-operative.
Yeah.
And then we've got the other kind of prehab, which is more, you don't have to be injured to do mobility and exercise. It's basically to make sure that you're not injured.
Yeah.
And I would say this is more relevant for the athletes. So that's prehab, is making sure that whatever you're doing continuously, say for a cricketer, your prehab can't just be strength training. Your prehab has to be dynamic. It's got to be something different that your spine doesn't experience 24/7. So what I do with a lot of like cricketers, and I use it as prehab as well as post rehabilitation, making sure that now that they've healed again, they don't go backwards. I've been using quite a bit of capoeira, which is really fun. I don't know if you know capoeira.
Yeah.
So
that's very cool.
Yeah, it's very cool. So I know a lot of cricketers will go and they'll play like soccer, but it doesn't mean that their spine is working any differently. That as a warm-up, for me, it doesn't make sense. You know, you look at a fast bowler and you see the torsion that the spine's going through and the dynamic movements of the hips and the spine. Because I've done so many other sports, I've done MMA, I've done, I do capoeira on my own at home. I see the dynamicness of other things that we could be incorporating. So imagine every cricketer went and started capoeira.
Yeah.
And that dynamic movement of side bending the spine, dropping down low, your spine gets so used to these movements and can control the velocity of it that is so much more beneficial for you as an athlete.
Yeah.
So I think prehab needs to be so specific to the sport you're doing that, but still make it fun.
Yeah. One of the things I've seen cricketers do recently is yoga. A lot more MMA fighters have also gotten into yoga.
So, that's great. You're however teaching your body to move slowly, though.
Oh, yes.
Do you see what I'm saying? So
and cricket's explosive. Is
explosive. So now you're teaching the muscles and the tendons to lengthen, and then you go and you play cricket with a lengthened, unexplosive tendon, and then what's going to happen?
Yeah.
So it's about balance. It's about having mobility, which is great in yoga. You've got that mobility, the joint mobility, but then how do you teach a muscle and a tendon to work in extreme ranges of motion but explosively?
Yes.
And it's not through powerlifting, because that's in one static movements.
Yeah.
It's through dynamic movements. So when I look at dynamic movements, I look at ballet, I look at gymnastics, I look at capoeira, I look at MMA.
Yes.
So understanding what your sport is and knowing how do you maintain a balance in everything is important.
Did you do MMA a specific type of martial art, like Brazilian Jiu-Jitsu, or did you do just the sport, MMA as a whole?
Yeah, just the sport as a whole. I was in my early 20s and I loved it.
Yeah.
When I came home with like blood nose and my mom is like, "This is not for girls."
Where did you do it?
So I'm from Boksburg, so no comments.
From Boksburg, so you did it in the streets.
No, you know what I do is like I've played a lot of sports. I mean, I even played baseball. Not that I was any good at it. I was in the second team and I was literally a filler because the Cardinals didn't have enough players for 2 teams, and they would strategically place me just in front of a big hitter.
Yeah.
So if I just made it to first base, then I was like home run.
So you had one goal.
Yeah, that was the one goal was to just make it to first base. But yeah, I think having a variety of understanding of sports.
Yeah.
I never played cricket, but my brother's 12 years younger than me, and I was always in the cricket nets with him, watching soccer, gymnastics, baseball, MMA. I did pole dancing.
Yeah.
So I've got a wide understanding of what it means to move.
Yeah.
And that means I can tap into quite a few things and sources of movements.
One thing I've learned or read about golfers, I was working with a lot of golfers last year, and also got into a bit of physical training with them as part of their mental training. And doing some research on that, so one guy, I can't remember who it was, but he said that with golf conditioning and prehab, you should be doing movements that are in the linear plane, because they're doing so many repetitions of the rotation of the spine. If you're going to be doing that in the gym as well for prehab, you're actually going to overtrain them. They're going to be overworking that movement. So to strengthen them in a linear plane to be better prepared for the rotational work, is that something that you would agree with?
Yeah, definitely. So, but again, it's got to be like a balance. So working in the linear plane would bring support and stability, and that's mostly like your core stability stuff. But it's also important so golf with a high velocity means that you need to strengthen in a low velocity to form control and then develop that high velocity with control. Okay. So I don't think it's any more important to do linear than it is to do rotational and counter-rotational.
Yes.
So when we're looking at biomechanics of the spine, a rotation is a forward flexion as well as a side bend. That's what causes the spine to rotate. So we would then look at their extension, side bend to the opposite, and rotation in the opposite direction. It's all encompassing. We can't just do linear work, can't just do core work. We've got to do agility work. It's about being balanced as a human. We're not just training to play golf. You're training to be healthy. Yeah.
What is the bigger chronic issue in society? Is it lack of core strength, or is it lack of mobility? Or something else? I'm just naming two.
So you can't actually have one without the other.
Okay.
Yeah, to be stable, if you are stable, you then lose mobility, which then forms instability.
Okay.
If that makes sense.
Yes.
Let me try to say that again. So, So if you're super immobile but very stiff, that stiffness develops weakness. The way a muscle length curve happens, it's a bell curve. Okay. So you've got really tight muscle and really long muscle on each side, right? The optimum strength is somewhere in between, okay? Yeah. So on the very tight muscle, you're going to experience weakness. It's like, I can't carry as much strength here as I can there.
Yeah.
And I can't have the same strength there. So we look at having a really good muscle length in order to be stable and mobile. Yeah.
So what should people do to have better quality of life? Core work first, or just some mobility work?
Yeah, so I mean, I love core work. It's like one of my other passions besides the mechanics. Done properly, it's not about core, it's about connection. The pelvic floor, the transverse abdominis, the iliopsoas, the diaphragm, the vagal nerve, the mind. Do you see where this is all going?
Yes.
So There's another breath work, and I've forgotten the name. I'll give it to you afterwards. But there's a breath work where you literally have to pull the pelvic floor up. And
Yes.
Dr. Joe Dispenza talks about
Yeah.
shunting that spinal fluid up into the brain. And that's basically what the spinal fluid is the pelvic floor is doing. So there's a force, a muscular force that helps circulate and circulate the cerebrospinal fluid. That's like for health and wellness.
Yeah.
Besides just the core for pelvic stability and trunk stability for lower back pain and hip injuries and knee injuries.
Yeah.
So yeah, it's full encompassing. I love pelvic floor work.
Yeah. Well, we're going to touch on that now. I want to just ask about breath work. Is it something you're quite comfortable speaking about as a expert?
I wouldn't say I'm an expert in breath work. That's why you're going to speak to Dr. Manga, which I'm quite excited to hear. But I do breath work with every person I treat. After I've observed them and I've had a conversation with them and I've gotten a deeper understanding of who they are and what they need from me, I get them to breathe. And why I get them to breathe is because I need to see where are they tapping into and where aren't they tapping into. Okay. So, and what I mean tapping into is what are they aware of?
Yes.
So
bodily now, in their movements? Or?
In their body.
Okay.
Yeah. So I always say you can't heal something you're not aware of. And what happens when you go through pain, you go through dissociation. So you dissociate from that point, that painful point. And the breath work helps me connect back there. So I use breath work to connect to the pelvic floor and connect to the stomach, because a lot of people shallow breathe and it causes anxiety. And it disconnects them from being grounded, if I can say. And being grounded leads to ankle injuries, knee injuries, and hip injuries. Or not being grounded, should I say. Yeah. So there's a whole process of just watching someone breathe and understanding them. And then correcting their breath to help facilitate the process of training. Yeah. You can't train without proper breath.
Yeah. And there's been a big movement towards that now. How important the breath is in a lot of things. What you've mentioned, but also in things like anxiety therapy and things as part of meditation and mindfulness. But it really comes down to awareness, am I right?
Yep. Awareness and connection. And again, so I started this like in my beginning years, like 8 years ago. I was observing people and their core. And I noted that it's not because their core is weak, it's because their breath is restricted. So when we do the breath work, and again, I'm going to tie that into the diaphragm and the vagal nerve and the sympathetic nervous system. Okay, so did you remember the pelvic floor, into the hip flexors, into the diaphragm, and then the diaphragm has got a passageway where our nervous system runs through. When that diaphragm becomes restricted and locked up, it affects the nervous system. And that's when we get shortness of breath, or we feel like we can't take a breath in. When I look at teaching the core work, it's about making sure that the body understands that the diaphragm can let go. We've got to understand, why does something tighten up? It's tightening up in an attempt to stabilize and give us support somewhere. Okay. And it's needing to give us support because somewhere else is lacking in support. And the primary support structure would be the pelvis. It's our weight-bearing joints, the hips, the knees, the ankles, the weight-bearing joints. If the pelvic floor and the pelvis, you're disconnected from it, you're going to move up and you're going to tighten into your diaphragm. Yeah. So that's where I need to get that change, is getting people to understand it's not just about the diaphragm, it's where are you lacking in support.
Yeah, that's very interesting. Well, I use breath work in my practice for confidence training.
Interesting.
Because a deep breath through the nose automatically helps you lift your shoulders, lift your chest up, so your posture changes. And just by changing the posture, you kind of feel, firstly, the breath allows, as you said, the release, and you feel fresh, but it also allows you to lift up and lift your chin and at least look more confident, which is the start of it, you know.
And so, again, that's so important. Sorry, I'm jumping in there.
Go for it, yeah.
It's so important because part of a good mental state is a good physical state. It's hard to be physically strong and have almost this mental, I wouldn't say weakness, it's a disturbed mental capacity. Because they do play hand in hand.
Yeah.
So yes, you might look strong, but eventually it does start to degrade the physical system with a mental struggle. And why I love that is because once you teach that to someone and their posture does change, they're less likely to pick up injuries.
Yes. There's a whole cycle, the connection between the mind and the body, which is actually something we can touch in, because I know we've spoken about it, but I know you have, well, on your website, you speak about conscious awareness. Can you just touch on that? What is that exactly?
So conscious awareness is, again, you can't heal something that you don't know exists,
Yes.
right? Down to the little molecules in our body, down to the hormones, never mind just the knee joint. We have this incredible power to heal ourselves, and this is one of those parts that I know that there's so much out there that I still don't know.
Yeah.
And I'm glad that I do work intuitively, because trying to put words to this is so complicated.
Yeah.
But that conscious awareness is, so I prefer to give examples. So
Cool.
again, recently treating a guy with a knee issue, and I'm watching him exercise, and I'm trying to get him to activate into his core, and I'm trying to I'm observing, not being forceful about this, but I'm watching that he's so in his chest. And I'm sitting there and I'm feeling it, and I'm watching him not do it wrong, but I'm watching him do it his way.
Yeah.
And I'm observing, and as I'm observing, I'm starting to feel what he's feeling. And it literally took a conversation saying, what is going on in your head that you're trying to move into your heart? Because I know that he was so in his head that he was so disconnected from the hips. And it was that little conversation about him saying he's thinking of moving from corporate, where it's very structured, into starting his own business where it's in his heart.
Yes.
And I said, okay, let's do a little bit of like chest opening and heart opening, and let's just breathe into our chest. And I brought it down to his stomach, brought it down to his pelvis, because that's where I always tell people, if you're feeling a bit angry, or if you're getting angry with your children, take a few deep breaths into the pelvic floor, and that's where you'll speak from love.
Yeah.
And
Okay.
he was speaking through mind.
Yes.
And literally letting that go and having that conversation, he could tap into his pelvic floor again.
Okay.
So that's what I talk about when I talk about connection, is
Yeah.
we're so often distracted from so much around us that we're not internal, we're not listening to ourselves, we're not having a conversation inside of ourselves. If you have to ask him now where you're at, he's probably making the changes to go into his own business, even though he doesn't have the support of working corporate.
Yeah.
So it's that's the connection. And again, it's different for everyone, and that's why it's difficult to have a textbook conversation about this, because your connection is different to my connection.
Yeah.
A woman who is having a lot of pelvic floor, or a lot of lower back, or a lot of hip issues, connecting to that could be different to a man who's thinking of changing corporate.
Yeah, of course. This is quite profound, because there's so many aspects to this. So every individual, as you said, is different. Everyone's going through their own thing. So as a biokineticist, traditionally just here to do some rehab after an operation or an injury, now you're tapping into the real healing part of things. And you really can't separate them anymore. I think we've come so far now that we understand in the Western world that the mind and the body and the soul cannot be separated. I like to think in sports psychology specifically that the mental side just underpins the physical side. So every little movement you do, the way you're walking on the course or whatever in golf, it's underpinned by something mental, whether it's an emotion, a thought, or whatever. But now coming into your world, understanding it even more so, and maybe not even just underpinning, but 100% just connecting. So this is awesome, by the way.
Cool.
So now there's people out there listening to this, and they sit at the desk all day. They got my posture, kind of like this on the laptop. What's step one for them to make a change?
Sure, making a change, hey? I mean, I struggle with change, so me giving advice is not the greatest. Change purely on the physical for me is small changes. Putting an alarm on and a 15-minute posture check. Okay. I don't like to tell people to change their posture. There's nothing worse than being told to like continually hold yourself up, because again, the physical doesn't come first. It's that mental that comes first, you know. So it can become quite exhausting, quite draining, having to focus on our physical outward posture all the time. 15-minute increments, maybe daily, maybe every 2 hours, but then you start to narrow it. Also, doing the strength work to create the change helps. So making sure that when you are training, you're using the muscles that support your upper back. A lot of people forget about the upper back. You know, what you can't see, you forget about often. And unless you've been programmed into training your upper back, people will continue to slouch. It's not normal for us to sit 24/7. It's not normal that people are sitting behind their desktops right now and having continuous meetings 10 hours in one straight go. It's not part of my world and part of my reality, because I'm always on my feet, moving and doing my thing. Even people who go to the office, who get into their car and get out of their car, have lost that getting into the car and getting out of the car. Small changes, breath work, start with breath work whenever you're in doubt, and strength training would be the three top ones to get a change in your posture.
Yeah. A lot of change comes down to having a reward system / feedback system just to show you that you're progressing or you've achieved something. How do you incorporate that into your practice?
So, I mean, that happens naturally because we are so observant. Someone comes in and I'm like, oh my God, you're doing so amazing. Look at you. Like, I can see a change. But that you'll only get every so often whenever you do come and see your bio. I think your friends and your family are big reward systems, and also the way you feel. And again, that taps into your shoulder thing, is feeling is part of that connection, and not staying stuck in the way you felt, because our brain can trick us.
Yeah.
We can change, but we can feel like we're not changing. So acknowledging self-change is a big one. I will see people change drastically and they will still come in saying, I'm this, I'm that. And it's so frustrating for me, and it shouldn't be frustrating because it's not my journey, but it saddens me to see people who don't see the progression in themselves. And I think that comes down to a number of things you as a psychologist would understand more about.
Yeah. I know where you're going with it, yeah.
Yeah, so whether it's self-worthiness, sometimes we don't feel worthy enough to feel better. Sometimes we are stuck in that pain model, and all we know is misery.
Yeah.
And that's when I would say bring joy into your life. You know, your body has changed. Go and enjoy it. Go on a hike. Feel how beautiful it feels to move. And enjoy what work you've done. If you rehab and you still sit at home and you do nothing, what is the reward? You can't, like, go out, go for a hike, enjoy your body.
Yeah. Yeah, enjoy what you can do with your fixed leg or your fixed ankle. Right?
Exactly.
Yeah, that's a good one, actually.
That's why runners and athletes are so cool to train sometimes, because they want it.
Yes.
They want to get back.
Yeah. Let's get into runners and athletes quickly. How often do you see, there's this thing about running and cycling, maybe less cycling, with a repetitive same motion, especially on running on the road, where there's this low-grade chronic inflammation leading to stress fractures. How often do you see that? Because I know you guys deal with comrades, runners and things like that, yeah.
Yeah, so we obviously see the acute state, and people are getting better at this in the sense that they now understand what it means to train functionally and not just for the sport. And I'm going to throw a name in here. You'd probably edited this out.
Depends.
So Bruce Fordyce once said, why stretch and why strengthen?
Yeah.
Just run.
Yeah.
I think it was him who said that. And again, that comes from a certain generation. people are now seeing themselves as a holistic being and understanding the importance of strength training and mobility training and making sure that the joints are functioning properly. You know, running isn't a hugely dynamic movement. You look at someone running, a comrade, it's usually a plod. So you're continuously working in this range. What you expect is going to happen.
Yeah.
You're going to stiffen up, you're going to tighten up, your joints are going to become immobile, and with that, inflammation.
Yeah.
For me, it seems a bit simplistic in understanding,
Yeah.
but it comes also down to time management and people's mental state. Why are they running like that? Why do they choose to run those long distances continuously? I treat a guy who's a triathlete. He's quite incredible.
Yeah.
And he did comrades with an Ironman training.
Okay.
Yeah. So he didn't train extra for running. He continued with his same training. He did cycling, he did swimming, and he had an incredible run time. No injuries, nothing.
Yeah.
So why are people doing mileages of 1,500 Ks when he did a mileage of 600 and was still capable?
Yes.
So taking that extra time, wrapping your head around the fact that you don't need to be on the road, do your strength training, go for a swim, train your body in other mechanics so that when you do run, you're not injuring yourself.
Okay, yeah. It's very, because running, the training and the exercise and the actual event, it's all exactly the same. There's no like, we're warming up now, so let's do some squat jumps. It's like, no, we're warming up, so let's do a run around the field. You know?
Exactly.
It's
like
just more running.
It's so strange that I'm like, what do you do for a warm-up? They're like, I jog for 5 minutes.
Yeah.
Yeah.
How are we doing for time, by the way? I don't know how much time you need.
We're still good.
We're still good, okay.
Yeah, we're still good.
So I want to ask you about, we'll get back to knee ligaments because something came up, and maybe I'm off sides with this, but maybe it's something you can speak on. Some school of thought say when you've had your knee op after tearing a ACL, you put on that brace thing for like 6 months, and you come take it off, and you maybe do like a little bit of a movement, and then after 6 months you can start progressing into rehab. Then I've heard of guys that straight after the operation, they encourage not to wear the knee brace, to start walking normally as early as possible, to start exercising. Is that true? And which school of thought would you recommend or follow in your, or is it different for every patient?
Again, it is different for everybody, depending on age, depending on strength pre-op. Depending on even the structure of our connective tissue. You know, my tendons and my ligaments are very different to yours. We'd have to do like a biopsy to see the difference. So I can't tell you if you've got a good ligament structure. Normally we would look at hypermobility to pick that up.
Okay.
But so I've had 3 knee operations myself.
Okay, wow.
And I was meant to go for a 4th one, but I had enough of the medical professions at that point. And I was so sick of being mismanaged in terms of rehabilitation that I actually didn't go for another knee op, and my ligament's been torn for, like, I don't even know, like 12 years now. But yeah. The reason why they want you to protect it initially is because the graft needs to take hold. So if you understand what an ACL ligament reconstruction is they take a tendon from somewhere, usually the hamstring. Yeah. They cut that off. They drill a hole through your bones, and they insert it, almost like either glue it in or like staple it in. The bone needs to form part of that tendon. The periosteum needs to attach onto that tendon. If you overdo it too early, there's a huge possibility of re-rupturing that.
Yeah.
My re-rupture was because I wasn't strong enough to support the tensile strength going through that tendon. So I think it is important that you understand, are you strong? And are you having to do like excessive rehab and being very controlled? So I would say rugby players and soccer players. I mean, you look at Cristiano Ronaldo. I remember that injury clearly when he was playing, and I was like, oh my God, he's out for like ever. Well,
you're Portuguese, so of course you remember it.
I know. I mean, there were a lot of like hurrahs in the pub at the time. But I was like devastated because I saw the mechanics of the injury.
Yeah.
Everyone's like, oh, he's just like messing around. Like, you know, Cristiano Ronaldo falls for everything. And I understood that mechanics of that injury. And I was like, he's stuffed. He's going to like, it's going to be a year.
Yeah.
Geez, like if I tell you it was like a few months later and I saw him training again, I was blown away.
Yeah.
Firstly, he was strong coming in. His proprioception, meaning how everything works dynamically, his ability to change direction, his explosive power. So his proprioceptions into his muscles and his tendons were so good that he could rehab faster.
Yeah.
So it just depends on your state pre and post-op. But I would say be cautious. Through my own experience, I wasn't guided properly in the sense of it's going to be a 6-month stint. When I asked my physiotherapist at the time, and again, I was like about 18, 19 years old, and it was life-changing for me having these knee ops because I was so active. I should have been told this is a 6-month process. Instead, I was told rehab and biokinetics is quite expensive, so just stop sports.
Oh, wow.
Yeah, and that affected
Jeepers.
me. That affected me hugely because firstly, you're telling an 18, 19-year-old girl who did gymnastics and like loves to jump around to go and climb into a pool and swim laps.
Yeah.
She didn't tap into my psychology and she didn't understand who and what I needed out of sports. If she had told me, okay, strength train for 6 months, here's a bio, it's expensive, but it's worth it. Instead, she's like, don't worry about it, you'll be fine, just don't do anything. I think it would have been a different situation. I would have been in a different place.
Yeah.
Yeah.
When you look at rugby players and they have their knee injuries, which is, I keep coming back to that one or the shoulder because it's the most common ones.
Yeah.
But you see them back 6 months in more often than not. And they're always wearing strapping after. For like the next year and a half, they're playing with strapping on their knee. But when you look at like Ronaldo or MMA fighters, when they do their knees or their shoulders, it takes them, let's use Wade Funike as an example, who's been out for almost a year and a half now, before he started running again. No strapping and obviously a lot longer before they've come back. MMA fighters, some footballers, not Ronaldo, and guys like Wade. Why is rugby so rushed in their getting back and then they're wearing strapping? Or is it just...
So we're looking at a few different body types and muscle types when we look at this. I don't know if it's the extra protein.
Oh, yeah.
Like, I'm not an expert in this kind of thing, but if I look at so there's a few different aspects. So we look at MMA, which is a contact sport. You don't want to show weakness. If the opponent knows where you are injured, that is a form of... I'm going straight for that joint and I'm going to rattle you with knocks to that joint. So MMA fighters, depending on how many rounds they can go through, it's not a hour and a half training or game session. So I think that's why they choose not to use the strapping. Firstly, not to show weakness, and secondly, short. Yeah. Soccer players have got a different muscle build and muscle type to rugby players. Strapping for rugby players, if they return to sport too early, could it be that they are just more creatine based? I don't know what's happening there, that they do return to sports earlier than the other sportsmen. Are they stronger? Are they more capable? Who knows? Yeah.
Is there truth in the theory, if you know about this, that taking creatine specifically at a younger age will lead to ligament damage more easily?
Yeah, so that's an interesting one. I tend to stay away from anything. I'm like such a holistic person where I'm like, if I'm not getting it in my food, why does my body need external sources?
Yeah.
Again, that's that's if you've got a healthy system that you can take everything in. But creatine is, do you understand like that you would have learned the creatine phosphate
Well,
cycle?
I think for the listeners, rather explain it. Yeah.
So a muscle uses ATP, adenosine triphosphate.
Yeah.
Okay. And so it's like it's a molecule with 3 little molecules attached to it. And when one of the phosphates release, that's energy,
Yeah.
right? So in order to replace that ADP that's now an ADP instead of an ATP, you need to put another phosphate onto it to release more energy. So what creatine phosphate does is it releases one of its phosphates and it adds a phosphate onto ADP to provide more energy.
To the muscles and things.
Yes, to perform a muscle contraction. So ATP cycle lasts like for 10 seconds. That's why a lot of your bodybuilders and fast twitch fibers, your sprinters, anything that happens within 10 seconds, they'll tend to want to use creatine. But what's interesting with the creatine phosphate is that there's another so we use creatine kinase to break up that creatine phosphate.
Okay,
if this makes sense.
Yeah.
But there's another protein in our body, and I can't remember the name of it. It actually inhibits muscle growth. We tend to find that in the aging population, and that's why so much atrophy happens when we get older. But there must be a reason why the body has something in our cells that stops muscle growth. So when I look at the muscle tendon junction, I understand that a tendon attaches onto a bone and the applied force is on the tendon. The muscle shortens slightly and it pulls on the tendon to create movement. Now, if we're feeding this muscle with muscle strength and muscle mass, not through anything besides creatine, what is happening to the tendon? Is the tendon becoming stronger with the loading, or are we just expecting now the tendon to suddenly be strong?
So the gradual strengthening of the tendon doesn't happen alongside the gradual strengthening of the muscle.
Exactly, and that's why we can start to damage tendons. But I also think, so when I think of creatine, I think of, so you need more water. People need to drink more water. And a lot of the muscle mass actually comes from that water inside the muscles. But I know that tendons and ligaments are made up of 80% of water.
Yes.
So what happens is possibly again, the body is absorbing water from all its sources to feed the creatine in the muscle. So we are dehydrating our tendons, causing further damage.
Yeah.
I'm not here to say I'm against or I'm pro. I just think that creatine is in protein.
Yes.
And just eat healthy, keep your gut healthy, and there's no reason why we shouldn't need to supplement, unless you are a high elite athlete who is just using more than you can take in.
Yeah, of course. Yeah, there's reason for everyone specifically, but as a general well-being thing, it's probably not the right way to go.
And I think, as parents, you're responsible for your children. Why start to teach their body to depend on stuff when you should be putting that energy into, are they eating healthy? Is their mind in a good state? Everything that affects our gut and our absorption, like Kim had said, let's rather put our effort into creating healthy bodies than looking for supplementations.
Yeah. What is your take on CrossFit?
I love all forms of exercise. I love all forms of sports. Years ago when CrossFit had hit the scene, I was inundated with injuries.
Yes.
And again, being like a gymnast, like I do sometimes step into ego.
Yeah.
And I look at these movements and I'm like, that's not gymnastics.
Yeah, they call it CrossFit gymnastics.
They call it CrossFit gymnastics, but if you understand what goes into gymnastics, we would train 4 hours a day.
Yeah.
And gymnastics training, actual elements like the beam, the vault, and all of that, probably took up an hour. The rest was strength training. Pull-ups, push-ups, the whole thing, proper technique. So in the beginning, when all these people would come and have repetitive injuries because they weren't strong enough yet they were performing the movements. It's like asking a gymnast to perform something on the beam without having sufficient strength. What's going to happen?
Yeah, they'll see their ass.
She's going to see her ass, like literally. So what's beautiful about CrossFit, and it's like with every other sport, there has been an enormous progression from what they understood CrossFit to be to what it is now. And they're much more educated and they understand the foundation phase so much more. So yeah, CrossFit is like any other sport. Happy for people to do it. I tried it once down the road here. Oh my gosh. I was in so much pain. Again, my ego took over because I know the movements, understand the mechanics. I was stiff for days and I actually couldn't move. I was struggling to work even. So I don't step into a CrossFit gym anymore.
I think what CrossFit does well is the community that they form. They obviously get choked for the community.
Yeah, I was just about to like throw in the cult word.
I spoke to Jason Smith, who's our #1 CrossFit athlete, and he explained why that even when you get teased for being part of the cult, it gives people's meaning and purpose and community. So there's something good coming out of it.
Yeah, and I mean, I've treated the Smith brothers for a while.
Oh,
and
wow, okay.
yeah, they're incredible.
Yeah.
I think he was one of the first, or the Kalami CrossFit gym were one of the first to really propel it to the next level.
Yeah.
And him as an athlete, I mean, yeah, he's incredible. Can I tell a funny story about him?
Yeah, for sure.
And I mean, we laughed about it at the time. I was just so I had like an 80-year-old granny walking on the treadmill, and he came in and he took his shirt off. And if you've seen him without his shirt on, I mean, granny's wrists and knuckles turned white. Like we had to slow the treadmill down completely. And she wanted to book every time he came in for treatment. So love them. Yeah.
When I posted the photo of him to say he's on the thing, my mom and my fiance were like, why don't you invite us to go with you to these talks? Yeah, but he's a great guy. I love him. Such a nice guy.
Yeah, and again, CrossFit, like they do it well. There's so many CrossFit gyms that do it well, that understand now.
Yeah.
And I think it means, so the trainers themselves have come for treatment. And within that understanding of why were they hurting themselves, they empowered their athletes. Understanding that a pull-up doesn't just happen from the shoulders, you've got to pull into the lats. You know, like not the basic stuff, but the stuff that they now teach repetitively is amazing. Yeah.
The gym that I'm part of, also down the road here, he's amazing at that.
Who is he?
Edouin, he's at CrossFit Cyprium.
Okay.
A little shout out there. No, when he takes a class, if you haven't done like deadlifts before, he doesn't allow you to put weights on. He spends time with you like the whole class, making sure your form's good, and won't allow you to go up in weight until he's happy with your form and your mobility and things. So there are guys out there doing it really well. So that's very cool.
Yeah.
If I can turn the attention onto you just to end off, a couple of questions I ask all my guests. First thing, your strategy or daily routine that you use to be more healthy and live more holistically.
Oh gosh, see, I'm like actually one of the worst when it comes to this, and it's now recently with COVID and me having more time for myself, I'm really learning to implement this stuff. But for the last 8 years, I've woken up and started work at 6:30 and finished work at 6, 7 sometimes.
Wow.
And often it's been throughout the day without eating a meal. And so I've done damage to myself not following proper balanced lifestyle.
Yes.
I'm at a point now where my work is, I don't need to do those hours anymore. And I'm now starting to learn the balance of things. For me, it is mindfulness. It's about making sure that I'm speaking the right language to myself. Instead of saying I'm tired all the time, now I'm starting to say I need to rest. Eating again, like yesterday, I went throughout the whole day, and I literally had sushi at 4:30, and that was like my first and only meal. Yeah, so I'm pretty bad with that. But again, I understand that sometimes our body doesn't need the amount of food that we do eat, and I've just got to make sure that I take good pre and probiotics when I'm not looking after myself the way I should be. Yeah, that's such a bad question for me. I get hounded by this all the time. But now, going forward, it's about making time for myself, making time to eat properly, and getting my proper sleep.
Yeah.
So those are my 3 big things.
Yeah. What are the 5 most important things in your life right now?
5 most important things in my life. Family and friends. It will always be work. My love, my passion. Being outdoors.
Yeah.
And sure. Yes, fine. This is going to sound weird, but it's part of my like holistic process that I'm going through. It's loving self and drawing love into my life.
Yeah.
A little bit of an overshare, personal stuff. But yeah, I've always dedicated so much of my time into helping others and building my practice that I have completely forgotten to receive. So I'm like, now it's like my time to like open up to love and affection and all the stuff that I kind of didn't allow into my life because I thought that it would take away from me building what I've always envisioned.
Yes.
They don't tell you this when they tell you about visualization. So when I was at varsity, literally I was like, must work on a sports team, must own my own practice, and must be like known for doing this amazing work. And I didn't know that I was actually putting things out into the universe, because within a year I had all of that straight out of varsity. Had I known, I would have like thrown in the love thing.
yeah, if you knew, yeah.
So that's a big thing for me now is that portion, yeah.
Okay, that's cool, yeah. And you may feel like you're oversharing, but I think every person I've spoken to has mentioned that as part of it.
Okay.
Posting one today with Dr. Jonathan Mach, who Kim put me in contact with, an amazing man, psychiatrist and holistic healer. That's all he was speaking about is that. So it's obviously powerful.
Yeah.
Do you read much? I want to ask you about books, but if you're not much of a reader.
So I've seen all of your your podcasts. I'm like, oh my God, if you're asking me about books, I'm such a fairy tale girl. Like,
oh, really?
I don't do the self-help books. None of the other stuff that everyone's like thrown in there, because I'm like, oh my gosh, I'm going to talk about Paulo Coelho. I love Paulo Coelho's books.
My mom actually told me about one yesterday.
Really? Then that means you have to read his books.
I have to go for it. Yeah.
Honestly, like I'm obsessed.
Okay. Can you give some names so I can?
So I'm going to give the most obvious, The Alchemist.
Yes.
Depends on how deep you want to go. The Aleph is incredible if your mind can go there and understand that concept.
The
Aleph, Aleph.
Okay.
He talks about past lives. He talks about, he's a Brazilian author who's walked such a phenomenal spiritual journey, and he incorporates that into his storytelling.
Okay.
And I absolutely love it.
Yeah.
The Pilgrimage.
Yes.
That's the last one I've read, because I want to do the pilgrim with my mom now. Like, she was planning on doing it on her own this year, and now I've decided I want to do it with her next year. Well,
that's crazy, because my mom was going to do it.
Oh, really?
And got cancelled with the COVID thing.
Yeah.
So, and then she told me about that book. So.
Yeah, it's powerful stuff. He talks about connecting to nature and so many rituals that you can do. Life is about ritual, and this is why I'm struggling so much with habits, is that I've only had certain rituals in my life. I'm trying to bring in more rituals, dancing, and all of that other stuff that brings joy into life, I
think very important.
Yeah.
As a way to end off, there's some stuff we didn't touch on that I wanted to, but I know you work with women specifically. Give a little chat there about that so that people can maybe find healing in you if they're struggling with it?
So that's something that's so close to my heart, and we'd probably do a whole nother conversation on that, is pelvic floor work. We carry so much in our pelvic floor. I haven't really delved into the masculine or the male side of it, because I know that there is something to that for men. It's just easier for me to work with women at the moment. We carry so much energy, and energy meaning emotion. Emotion is just energy in movement. And when I tap into work with pelvic floor work, it really brings out a lot. It brings out tears, it brings out anger, it brings out shame. And with that comes a whole lot of other emotional aspects to healing. So maybe we can tap into that in another, more lengthily, because it's got to do with energy, it's got to do with emotion, it's got to do with dissociation, it's got to do with how we've been programmed to think of the pelvic area, the words we use, what is shameful, what isn't shameful. So I quite enjoy that work,
Yeah, awesome. Yeah, I wanted to get into that, but I think we'll do another one and then can get into that more, the deeper stuff.
Okay, awesome.
Thank you so much. It's been awesome to chat to you.
Thanks, Nick.
Where can people find you? We're at Synergy Holistix, but online, where can they reach out to you?
So Claudia Santos, biokineticist. Basically, that's my Instagram, that's my Facebook, that's my website, yeah. So
Okay.
ignore all the other Brazilians in their bikinis. The real Claudia dos Santos from Johannesburg is more on the medical side.
Okay, we'll find you
I
there.
have Googled myself.
Is it? Yeah.
There are a lot of Brazilian girls in bikinis.
Okay. I'll link to you, and then I'll link to another one just for the fun of it.
Yeah. Thanks, Nick. I really appreciate it. Not as bad as I thought.
No, you did very well, and I think you shared a lot of good information, and I learned a lot from you, so thanks so much.
Pleasure. Thank you.
Awesome.